when I applied for healthcare rehab, Spaulding called me as other hospitals called me. And I said, now I'm going to choose the best place. So I chose the best place, Spaulding.
That's great.
Well, first of all, the energy is amazing. You walk in the hospital, you feel the loving and the peaceful energy. It's all about all about humanity. And no matter who's coming for rehab, no matter where they come from, we give the same love, the same attention. And all patients, I tell the patients, all of you are my VIPs. So, and they are. And it's this energy, this positive energy and the teamwork that I feel here, that's my way to work. The support for education, I am totally in passion with education, and I decided to go back to school after 27 years, having 2 degrees in the past. So, and it's my goal to keep going to school, and I'm right now in expressive art therapy with Leslie University, and the hospital is giving me some support for that, and I love it.
For me, it's a team environment. It's all about interdisciplinary cooperation. I've learned a ton working with different physical therapists, occupational therapists, speech language pathologists, and even the doctors. It's a really small, comfortable family atmosphere, and you're comfortable enough to go over to the doctors and be like, hey, I have a quick question for you, and you never have to feel like you're interrupting them or putting anybody out. You're just learning, and everyone's been really supportive, and not just the doctors, but the therapists, other senior nurses, my supervisor. It's just it's a really good place to learn. So I'm a lifelong Cape Codder. I grew up in Mashpee, and I still live on the Cape. So to me, Spaulding Cape Cod is the perfect place to be. But even if I wasn't from around here, it's such a beautiful area. There's always plenty of things to do, especially in the summer. And I never have to really leave the Cape. I don't have to sit in traffic to get to work. The team collaboration here at Spaulding really means that each member of the care team really knows these patients. They're here for usually a couple of weeks, and we get to know them and we get to know each other by working together to provide the best outcomes that we can for these patients. And it's really inspiring to see the recovery that is possible with this type of close collaboration. But not only that, I'm learning a lot. I'm learning different ways through some of the things that the occupational therapists have taught my patients and myself, different ways to help these patients progress with how independent they are able to be with their ADLs, or different transfer techniques that I wouldn't be able to come up with on my own, but the physical therapists who have seen it all can teach me and show me. And even being comfortable enough to walk up to a doctor and say, I haven't seen this diagnosis before, can you just explain it a little bit to me? And it makes me feel like a better nurse, because now I've got all of this knowledge and experience in my backpack that I can pull out anytime I see it in the future. So I actually did graduate from a local community college, and one of the things that I was looking for in finding a job was, am I going to be somewhere that I'm supported? Are people going to be looking out for me, and am I going to be comfortable asking questions? And from my experience, I have never been more comfortable than I am here at Spaulding Cape Cod. Everyone is friendly. Everyone has knowledge that they're willing to share, and I never feel like I have to go into a room alone. I'm totally supported by my team.
My name is David Athamni. I'm a PCA, which is another name for being a certified nursing assistant. I went to a vocational high school, Upper Cape Tech, and I took a CNA program at that high school. And during my junior year, they offered a co-op program that connected me to Spaulding. And that connection to Spaulding was one of the biggest success to my path towards nursing school. Working here offered me not just the resources, but also the opportunity to grow my passion towards nursing and stuff. I started here back in 2019 in May, and when I first started on the floor and stuff, the staff were so nice and everybody was just so amazing, and we worked in such a great team. And to see how how the nurses worked with the patients and how therapy worked with the patients gave me such a good outlook on what I want to do with my career, and I just stuck with it since that day. And right now, currently, I'm in nursing school, and I got a year left to finish, and hopefully I'll be working here after that. I've never seen anything like it before. Working here, honestly, just seeing the amount of passion the nurses put into the patient is amazing. Nowhere else you'll see a patient come in that's not able to talk or walk, and in 14, 20 days they're walking out here and they're smiling. And just to put a smile on a patient's face is the greatest blessing I've ever been able to experience here at Spaulding. Well, a few reasons why I would tell you first thing to look at Spaulding for obviously a co-op job and maybe a good way to figure out what you want to do with your career and stuff is because Spaulding offers a unique type of care that you won't see anywhere else, and something is very hard to find at other facilities. Like I said, we work so close with our patients, and our patient numbers between assignments are low, so you're able to spend one-on-one time with your patient. You're able to give them the care. You're able to give them, the ear to listen to and everything, and to be able to understand what they're going through and to help them. And it's just something I haven't seen anywhere else. And first thing, I work the evening shift, and we're able to learn a lot more being able to spend more time with the patients. You spend time with the nurses, and then if you're going to nursing school, the nurses show you how to do wrappings and stuff on the patient's legs and show you how sometimes medications are done and all that. And the therapy part of it too is amazing because therapy teaches you how the patient transfers and how they do their mobility on day-to-day care. So during the evening shift, you're able to implement that and continue their therapy, not just during the day shift, but also the evening. And hopefully they're able to leave here in a week or two, and they have the biggest smiles on their faces I've ever seen. I'm committed to Spaulding, and Spaulding's committed to me. What you put into Spaulding, Spaulding will surely return to you. And if it will return with you with skill-wise and with knowledge that you won't see anywhere else. My name is David Athamni. Thanks for watching, and maybe I'll see you on the evening shift.
This facility in particular, because it's on Cape Cod, it definitely offers a quality of life. You're living on Cape Cod, for heaven's sake, so you're really going to get that opportunity to just have the good life as part of being on the Cape, but you're also going to get the opportunity to, especially if you're just new out of school, you're going to get the opportunity to work at a smaller facility, tight-knit facility, to grow your skills. And then you have the opportunity where Spaulding, again, is part of the Mass General enterprise, to go on if you wanted to. If you didn't want to stay in rehab and you wanted to go to acute care, you're within the system already, so you have that, the little niche that you can just move on if you wanted to. I've always been in kind of a supervisory position as a charge nurse, and the managerial position just offers more opportunities for me, and towards the end of my career, just to seeing more growth for me as well. So I've learned a lot, even as being a seasoned nurse, as opposed to being a nurse that's just right out of school. I think it's because of this, the fact that we are a smaller facility, and it's just everybody knows everybody else. It's one floor, it's two sides to one floor, so you know everybody that you're working with. And on even days, evenings, and nights, you'll know the other shifts as well, but you really know the strengths of your counterparts on the evening shift, for instance. You know what they're capable of doing, and you can rely on them to help you out if needed. I think in an emergency situation, which is what I love to see the most, is I don't love to see an emergency situation, but in that, you see how well people work together, and then no one is going to let you falter. They want to have everybody succeed, which I really, really see that here, and that's what I really appreciate about working here. Sure. So again, my name is Diane Coletta, and I thank you for watching. And I really encourage you to look into coming to Spaulding Cape Cod. It's a great facility to work at with great people to work at, not only in nursing but in therapy. And you see that these patients really, they really benefit from our work that we do. And we are able to maximize their abilities and have them hopefully go home or back to their most normal lifestyle that they can obtain. If you're interested in coming to work here at Spaulding Cape Cod, my name is Diane Coletta, and you can reach me at Spaulding Cape Cod Hospital. My number would be 508-833-4222. That's the nurses station, but always messages are left, and I am here. I am here frequently, so I would get that message and would love to hear from you.